Hi, this is Stephanie. You're listening to the Healthy Practitioner Podcast, where we talk health, wellness, and all things detox. Hello, welcome to the Health Spa Podcast.
Oh boy.
So my name is Stephanie Grutz. Just to introduce myself to the audience, I'm the owner and nurse practitioner of the Health Spa and Select Balance Supplements. And I have Lindsay Wedewer here to do an interview with me today. So I'm really excited for this, Lindsay.
Well, thank you for choosing me. I am way excited to be on this. I'm Lindsay Wedewer. I'm the owner of LW Communications, and also I'm a patient here at the Health Spa, and it's kind of my happy place. I'm not going to lie.
I love it. It's my happy place too. I'm really excited. We opened this building in October of 2023, and it's just really everything that I dreamed of coming true. So it's really awesome. And, the reason why I really wanted to do this podcast today was because there's so many people that have questions about integrative medicine and the services that we offer in a holistic approach. And I was like, what better way than just having a candid conversation and see what kind of rolls from that. So
I love it. I'm excited.
Thank you.
Should we get going?
Yeah, let's do it.
Awesome. Okay. So what I want to know, can you start by explaining the difference between functional and conventional medicine?
Yeah, I get that all the time. So really what functional, holistic, integrative, there's so many different, words to describe what we do. And that's what is confusing to people as well. But if you think about conventional, it's like your typical doctor. You go in, you get a 5 to 10 minute appointment. They listen to your symptoms, they give you a medication, and then you're sent on your way. Or you get a couple pieces of lab work done, and they're like, oh, everything looks fine. And you're like, oh, I don't feel fine. And so then people start seeking other options. They're like, well, why do I have these diagnoses or these conditions? I feel like I should be healthy. And so then that's where they reach out to functional medicine. And what we do is really look at the root cause of why things are happening. We might use medication because not all meds are bad. And, we truly try to integrate all the worlds of healing and figure out, okay, this is why this is happening. Let's use this for a short term while we're getting to your healthiest point.
I love that.
Yeah.
I love that you're not opposed to outside ideas, and because that's another thing. A lot of people are like, oh, it's only one way or no way, and that's not the case with you. So
yeah,
that's pretty awesome.
That was going through my journey of being in conventional medicine, a conventional medicine trained nurse.
Yep.
And I was a conventional nurse practitioner, and then my own health journey of an autoimmune disease had me start thinking about things. So I went from one side of being you have to do conventional medicine to the total opposite of conventional medicine's terrible. And then in my 30s, of wisdom, I'm okay, really it is a blend, and we have to honor where everybody is at their journey.
Yeah.
And it is all helpful.
I love that. Actually, speaking of, let's dive into that. Why did you start Vive? Why, I guess, back up. Why did you even go the conventional route? I love hearing your story. I could hear it 10,000 times over again.
Yeah. Well, my mom was a nurse growing up, so I knew that I wanted to be in the healthcare field. So I became a nurse. And then as a nurse, I was working at a nursing home. And I'm just telling the doctors what to order. I should be doing this, all this 20-year-old ego, So I was I'm going to become a nurse practitioner. So I went and did that. And my first job was actually in acute long-term care. It was running a mini hospital. People would get discharged from the hospital and then come to, it was called Manor Care at that time. And so then I would order x-rays, labs on site, but I'd go through the dining room to do rounds, and I'm these people are eating pancakes with syrup and they're diabetic, and what are we doing to these people? So I didn't feel the fulfillment there. I knew that I needed to get out of that. And then while I was on my own health journey, I started learning about leaky gut and things that I never heard. And I'm oh, that's what I have. So when I was trying to heal myself, I was I have to get out of this world. And I got connected with an acupuncturist in my hometown, started seeing people one day a week there, and she was kind of feeding me her patients that needed lab work. So it was just a beautiful transition. And then that's when I just started taking a deep dive into integrative medicine, and spending literally from the time that I'd get off work to go to bed, like just learning everything that I could. So that was in 2015.
That's incredible.
Yep. Then 2016 is when I opened my own practice.
Wow. You had to be really determined. You had a fire.
Yeah.
You needed to feel that. That's awesome.
And I was young. Like I went from college being poor to making good money. And then I'm like, I don't have anything to lose. I'm going to this is what I think will fulfill me. So I'm going to do it. I don't need to make $1 million. And my drive was always like to truly help people. Like, why did I get into this career?
Yes,
so
absolutely.
That's where it was made.
Well, and unfortunately, obviously you did have your own health issues, which really ultimately decided you wanted to seek something else. But because that did happen to you, look where you are now.
And I tell everybody that too. There's no such thing as good or bad experiences in the world. It just is.
I agree.
And like everything that was in our small 900 square foot clinic, the IV therapy, was because I have Crohn's and I couldn't absorb nutrients. So I went and found this modality. And then the hyperbaric oxygen chamber. Nobody had that in the Midwest, but I was like, I need to heal my intestines from the insides out. So that's why I got that. Sauna for detoxing. So everything that we ever have was like an offset of something that I knew I needed.
Yeah, you had to try it out first.
Yep. So then I knew I couldn't fail because it was me trying to heal myself.
Yeah, which is great. Oh, I love it. Oh, the old clinic.
Yeah.
What a difference.
Totally.
Yes, I was there for a couple of years and then look at this. This is awesome.
Yeah, we grew out of our space pretty much right away. Yeah. And like, I had all these ambitions. I'm like, I need to get these services under one roof. But the patience and the timing, it meant everything because this location wasn't even a thing back then. Mm-hmm. And so one day I was driving by because I wanted to be on the highway close to where Wisconsin, Illinois, are people from Cedar Rapids. Like, we just have so many people that travel. I wanted to be able to have access to them. And when I saw this place open up, I'm like, oh my gosh, this is it. So waiting also is a very good virtue too.
Yeah, I was going to say, you're pretty patient because there's a lot that I know you want to do. Well, maybe still want to do, but at the time you did want to do, and you just had to have this fall into your lap basically. And yeah, it's a great location.
Thank you.
I love it. Well, the building is incredible too.
We threw a bus in there to like just to keep us busy. Like, we just, we can't have any downtime at all. Alex, my partner, and I, who does this all. So we're like, let's just get a bus, and which was really actually helpful. So like I said, a lot of our patients would drive an hour and a half to our clinic. So we took the bus to those people and just had a hub, and then people would just come. And that's why currently now we have a location in Peosta and then our location in Cedar Rapids, because the bus kept filling up, and we're like, okay, we need to have a place here too.
That's so cool.
Yeah.
I think you should do like the bus for like parties.
Yeah. Everybody says that. I'm like, okay, guys.
Like, have a whole I don't know. Have a group of girlfriends and just get some IVs.
Yes.
Okay, that sounds fun to me, but not everybody else.
Yeah, you ask your friends if they want to get it.
I have a few friends that actually might do that.
Okay.
Okay, so speaking of your patients, what kind of people do you see that come through your doors?
Yeah, really a wide range. Like, everybody from, we have kiddos come in that have a history of, infants that maybe have started out rough, like have infantile seizures or eczema or other things that are really like crippling to them. And then we get up until the 90-year-olds that are like looking for quality of life. Maybe they have cancer before they're passing, or maybe they just have dementia or something like that, that they just want to be supported and live their best year. Like, if they're going to be living, they want to be as best as they can. So honestly, it's everybody could benefit from integrative medicine and the different therapies that we offer. I'm saying the extremes, but in general, the people that are most common are people like you. The people that just feel depleted, or they don't even know they're depleted, and they're like, hey, my friend is trying this, I'm going to do it. And they come in and they're like, whoa, I feel different. I feel energized, revived. And and you can speak to your experience.
Oh, yes. 110%. I started coming here because I was pregnant with Monroe, so my second baby, and one of my girlfriends, she's like, Lindsay, you gotta go. I'm like, but I don't like IVs. Like, for me, delivery, that was the scariest part. Like, I don't want an IV. Oh my gosh. You guys, your nurses are phenomenal. I love them. Everybody makes you feel so comfortable. I mean, you don't even know you have an IV. I don't know. But anyway, so I got the IV. I got the pregnancy IV. Oh my gosh. That changed my world.
That's awesome.
I fortunately, like you, like very healthy pregnancies. But there's just sometimes I was just exhausted.
Totally.
Which obviously it takes a toll on your body. We know. But yes. I don't know. And since then, I'm hook, line, and sinker. I just love it. I love how I feel. I love that when I come here, I can not only relax, but I can also have a good conversation if I want with your staff. Everybody is so kind here. Yeah, it's like I said, it's my happy place.
Yeah,
I love
thank you. Yeah, and that's a good like point too of saying like you started in pregnancy. I got infusions throughout my pregnancy as well, and I just because I knew that I wanted to stay.
Yes,
I wanted baby and myself to be have good nutrient status throughout pregnancy, and so. People are like, oh gosh, that's scary because they tell you everything in pregnancy is scary. But really there's a lot of studies that show how the safety and efficacy, especially if someone's like sick every day their first trimester, like get a stress support or a nausea shot. Like there's so many nutrients that can help offset these, like there's just deficiencies. That's why we feel this way. Yeah. So like giving ourselves nutrients, and especially before the baby comes, you're just helping yourself and the baby.
Yes,
so
exactly. And you don't know what your body's lacking. You really don't.
No.
I mean, yeah, especially during that point in your life.
Yeah, for sure.
I do want to talk about, okay, so you treat a wide range of patients that walk through your door. Okay, so me as a mom, like if I have like my kids, if they're under the weather, like how would you treat children?
Yeah, so typically what I have people do, like if they're young, I stick to like nebulizers. So nebulizer is a mist that goes over their nose. Some of them tolerate it, some of them hate it. But like even if it doesn't go over their nose, you can just put it underneath and let the fog go up, and they can just inhale it in. But we do that with glutathione, the body's major antioxidant, colloidal silver. There's just different modalities that we can use. And then I have them supplement, like elderberry syrup. We can use powders in their smoothies or something, but I really try to be non-invasive with kiddos as much as possible. I like getting labs on a kiddo. I just try to think of their future. I don't want to traumatize them for wanting to go to a safe space.
Yes.
So we're really, if someone's really sick, then we think about that, but we really try to make it easy.
Yeah. And just basically educating the parent, I'm sure.
Yes.
And just explain to them, like, their immune system is just down right now. You need to build it up.
And everybody, so like, that's the thing with Western medicine, like a kiddo has an ear pulling, like their ear aches. Well, looking at the research, almost up to 90% of ear infections are viral. Mm-hmm. So we're throwing an antibiotic at something and it's getting better. Well, it would have got better no matter what. But the mom in us, now I know that as having a 20-month-old, we want to treat them right away. We want them to feel good. So we think giving them something, we're doing something. Yep. So I tell all my moms with kiddos with ear infections, go and get garlic mullein oil and put that in their ears, and that will get rid of things way faster than any medication could.
Yep, 100%. And knock on wood, thankfully, our children have not had to deal with ear infection, but I actually suggested that to my stepmom. I told all my friends about it. I'm like, just try it, give it a day. And then I get it, you got to do your thing. But yeah, just there are alternative methods out there. They're worth trying.
Totally. And like you're saying, people just don't know. Like you don't this know. Is what you grow up with. And so this is what you think is all that's out there. But no, garlic mullein, get rid of the dairy for a few weeks because that can create mucus and build up. And a lot of people kiddos that have tubes even, like they don't need dairy, like, and they don't even need tubes. Like if we cut the dairy for 4 weeks, but again, it's work on the parents to formulate a dietary plan for them, and it can be stressful. So having someone in your corner that can help you with that, like a functional practitioner, can really help like ease that transition.
Oh, I completely can attest to that. Because with Stella, she was kind of, she's the first. I didn't know what I was doing. Like you said, you're just worried about all the time. You're like, oh, and then slowly I got more confident. And then thankfully the doctor that she was going to was more open-minded about things. So she didn't push anything on us. And so then I was just like, wait a minute. If she's saying this, I don't know. It kind of got me thinking. And then obviously I entered the whole like integrative world and my mind was blown. I was like, wow, this is fascinating. And I'm learning every day.
Yes.
I don't think I'll ever stop learning. But Yeah. So anyway, that's a whole other tangent.
Yeah. No,
but yeah,
great.
so thank you, because that's very helpful. And then obviously you talked about like people similar to my situation. It just makes you feel good. And then yes, the older generation, again, quality of life is obviously there. That's what most people want.
Totally.
So, also, okay, so let's get into your supplements. You have how many supplements now?
I haven't recently counted, but over probably 110.
That's amazing.
Yeah.
That is incredible.
Yeah, that was quite the beginning. So like in 2016, when we opened Vive, simultaneously as I was working through my own health, I was learning about the quality of supplementation and really the lack thereof. And like there's no FDA regulations on what goes into your supplements. And part of that's good because they would probably try to, have the pharmaceutical companies like limbo that. But you need to know what's in your product. And a lot of the stuff that's sold in Walmart and CVS and the drugstores, like there's just a bunch of junk. There's fake colors, fake fillers. And when I was seeing that, I'm like, why would my prenatal need to have fake dyes that are carcinogenic? Mm-hmm. Like that doesn't make sense. So from there, I was like, well, how can I formulate supplements? So I looked, there was a lot of like really good brands that let you white label them. Which means you just get a sticker on that says it's your brand. But I was like, no, I want to actually know the ingredients that are going in and source them and all of that and figure out like, okay, a capsule's this big, so how much magnesium can fit in that? And like, it's quite the experience to get into.
That's fascinating.
Obviously, it's a lot of work. So we started with maybe 1 to 5 supplements. Yep. And then that was 2016. And from there, we just really grew. And I was mentioning this earlier, a lot of our, core supplements are 80% of what people purchase. But then there's all of those outliers for people that we really want to encompass a whole line for people so that your family, from your kiddos to your husband, can come in here with you and you can all get your needs met.
Oh yeah, and we do. We're big advocates of that. Like a friend's like, oh, where do you get your vitamin D or C? The generic, typical ones. I'm like, oh, Select Bands. Like, here you go. It's just, and for me too, also as a mom, one-stop shop, done. And supporting local, it's always a plus too in our house. Also, okay, so you talked about having a choice over all the ingredients. Can you talk about that a little bit? So what sets your supplements apart from any other supplement? And kind of the ingredients? I mean, obviously all ingredients are different, but what makes them different, sourcing wise, whatnot?
Yeah. So when you're picking like a product, there's different types. So let's say you're, folate, for example. You hear everything, especially in pregnancy, like you need to take folic acid for your kids' neurodevelopment, all of that. Well, it's really not folic acid. Folic acid is a synthetic form, and it's not great for your body. And if you have any methylation issues, which is a whole nother podcast, but if you have things like MTHFR, a lot of people hear of those mutations, your body doesn't break down the folic acid and get it into your bloodstream. So like there's this block here. And so it's trying to get into its form, but then it won't get there. So then it can build up into the system and it just actually creates the adverse effect. So with like folic acid or folate, we get the methylfolated form. So a high quality, it's absorbed systematically. And so all of those things go into your product. I tell people, if you see folic acid on the back of your label, or if you see cyanocobalamin, which cyanide is the first part of that, that's B12. It's a cheap synthetic form. Your body has to detox part of that, and you don't want that. You want something that's easily absorbed into your system. So we use all methylation. We actually get third-party testing. So it'll go to the manufacturer. We will get a third party to look at that ingredient and make sure that it is what it says.
Wow.
And
that's
then,
awesome.
Yeah, so I mean, all of that stuff. And even with like the back of a label of like, there's sneaky ways that companies get around like, oh, they don't have to disclose all the ingredients or something because it's a smaller percent. Mm-hmm. But we don't do that. Everything that we have in our product is labeled because it all makes a difference.
Yeah.
So that's the difference between someone knowing your farmer, as you know, as a farm wife.
Yes.
Knowing your farmer, knowing your supplement manufacturer.
Yep.
It all makes a difference.
Knowing where your food comes from. Because
Exactly.
a supplement, obviously, you're trying to subsidize something you're not getting in your food. Same situation.
Exactly.
I love that. That's
Yeah.
good. I like that. So if I were just to be anybody coming in, and I went to the front desk, how would I know what supplements that I need? Like, how would somebody start? Does that make sense?
So I have people, like, if you're just wanting general health,
Yes.
Like a regular multivitamin, and the girls are really, or the staff, they're really educated on what we have. Even our website, select-balance.com, we have information. Like, I try to make it as in depth as possible so that people can advocate for themselves, like, and be like, oh, that is what I need. But we're always here to make suggestions for people too, because sometimes they're stepping into a world that they've never been in before. So we always help them with that. But like, so Alex, my partner, created all of our labels. So when we did this, I created what was in it, he created the labels. But you'll see thyroid support, UTI support, adrenal support. Like, you'll see things like it's all support of the organ system or whatever, so that it makes it easy for you.
Yep.
So that's how we kind of help.
I love it.
Yeah. It's all about empowering. Like, we want you to be able to make that decision.
Oh, yeah.
But we will be here to help answer any questions.
And 100%, again, I can attest to that, because when I first started coming, I was like, oh, maybe I should start getting some supplements too. And that's another thing. The front desk, actually, I think it was Kirsten, she explained everything to me, but obviously she never pushed anything on me. She's like, hey, try this out, see if this works. Like, and then you just kind of grow. Obviously, the more knowledge you gain too, you're like, okay, this would help with this. But yeah, so I can say, yeah, your staff is amazing. They know what they're talking about.
And there's some times that a person will be like, what do you think? Like, should I take this? And they'll be like, actually, no, that isn't the best. Like, good try. Just like anything else in life, when we're trying to learn things, like, that's good, but actually this one might be better for your body. And at the end of the day, they get to make the decision, but just educating them in between is really helpful.
I love that. That's awesome. Okay, that was supplements. So how do your staff, how do they determine the right treatment protocol for individuals coming in?
Great question. So, depending, again, our IVs are very similar to our supplements. So when you go onto our IV website, or if you're here, there'll be like a list of the bags or infusions that you can get. An antiviral infusion, an immune boost, pregnancy infusion, migraine buster, breathe easy allergy asthma relief bag. So there's these, we labeled and named them on purpose so that it can be like, oh geez, yeah, this is what I have going on, this is what I think I need. And then they talk through it, and they ask the nurses, who are very educated in every ingredient that we use. And then the nurses usually, if they're not sure what to recommend, they will always message me, or we'll be in touch in the clinic, and we make a little plan for them. But, typically when people come in, they're like, oh, do I need a doctor's order? Do I need, what do I need? And they don't need anything. There's a couple infusions that require labs prior to getting them, and we, make that known. But typically people can come in and get an immune boost without having to have any special orders. I look through everything. They fill out a history and physical form, so I know what medications are on, what their past history is, and we just look at that. But luckily, vitamins, high quality vitamins, which we are very dedicated for as well, are pretty good in the body, and we, knock on wood, we have really good effects without any, severe outcomes. So
that's amazing. I love that. Also, you talked about like labs. Is that something you offer here if your patients might need some for whatever reason? And how do you determine if they need labs? I guess, do they just come up like, hey, I need some lab work done, or?
Yeah, so sometimes, if they're getting a specialty infusion that requires it, we have it in, our nurses do the phlebotomy here. We have a centrifuge, we do all of that. We have, we work with a partner that's great that actually takes insurance. So our labs that we do
Awesome.
in-house can get sent to the main insurance providers, which is nice for our patients. Anything that can be cost savings, because this is kind of going down a different tangent. But
that's a whole nother conversation.
Yeah, but like our services are cash pay. But if you have HSA or flex spending, you can utilize it towards that. And again, that's just the conventional medicine not wanting to have the support. But we do our labs, and if people want to get their labs drawn, we have a lot of Amish clientele that come in, and we also have a nurse practitioner, Maggie, who sees patients. So we might say, oh, maybe an acute visit if you're acutely sick. She can quickly say, hey, I'd get these labs. The nurses can draw them, so it's the same day, same shop, in a place that's beautiful and healthy, and you're not worried about sitting in a waiting room with a whole bunch of sick people.
No, I know that. Yeah, the whole mindset here is completely different. And like you said, like especially like little kids, if for some crazy reason you would need to do labs for them, at least it would be like a safe, happy environment. They hopefully wouldn't be traumatized down the road. Also, like talking about that, let's just spin off, and can you tell us like everything that you offer here at Vive? Because it's a whole lot of things.
It's growing every day too. So, what we brought over everything that we had at the old clinic. So we have our IV nutritional therapy, which is our bread and butter, what we, are known for. We have IM injections of nutrients, nebulizers for kiddos, and adults, red light therapy for inflammation, just general overall health and wellness. Vibroacoustic therapy, which is like,
cool.
I know, we'll have to talk about that. So it's like a massage table, but a water bed where frequencies go through the headphones and it vibrates through the water in your body, and it just puts you into parasympathetic, just helps your nervous system relax. We do ozone sauna, which is like a special steam sauna that actually pumps in oxygen and ozone, so O2 and O3, and helps detoxify the cells. We have hyperbaric oxygen therapy, which is like the kids call it a spaceship, but it pumps in oxygen and air and pressure, and it helps get blood to the areas that typically don't get it. So bone fractures, brain health, any of our oncology patients, to support them, everything, like if they do infusions, that just like surpluses what they're getting because it's getting driven into their cells. So there's so many positive effects for hyperbaric chamber, and we had that at the last clinic too.
That's amazing.
Yeah, and there's more. There's ionic foot detox baths. I know so many people, it's so funny, like have all these like ladies come in and like, oh, I can't wait to have a girls' day, and then they're like, oh, this is disgusting.
But you feel so good.
Yes, totally.
That's awesome.
This month we're actually releasing True Roots organic hair salon. So we have a 1-chair salon where we'll be offering like henna coloring, natural conditioning treatments, wash and cut. I was telling people that like this stemmed off of Kirsten, who works here as a cosmetologist by trade. And when I was sick, I had a good dear friend in town who owns Body and Soul. She gifted me hair washes. And when I had like a PICC line in and I was sick, like it was such a gift to just be able to go somewhere and get treatment and not have to worry about it.
That's amazing.
And now here we're just going to have that for people, and they're going to be able to come in and they're not going to have to worry about if there's chemicals in their shampoos and conditioners. Everything is organic, chemical free. And it's just something that I'm like, this is going to be cool.
Yeah. Can do all the things. Come here, spend an afternoon or a morning, and just get pampered in a healthy way, and not be worried about any toxins getting put in your body, especially then.
Yes.
If you're really sick, like that's the last thing you need is your nervous system to go haywire.
Yes. And, with that, like we have our aesthetic room that will be opening hopefully within like the first or second quarter of this year, but we'll be doing something, they call it vampire facials. I don't know if you're familiar, but you actually take blood, spin it down, we take the plasma rich platelets, and then we can inject them into the face or scar tissue. So at first I was like, I'm not doing beauty, like that's not what we do here. But then it's like, you know what, even the people that have been through the worst, chronic disease, cancer, like they deserve to feel good. So like even with scar tissue, you can put your plasma-rich platelet in those tissues. And I'm doing this because like a lot of people with mastectomies or with C-section scars.
That's what I was thinking. Yeah.
It will help break up that scar tissue and heal it so much faster.
That's amazing.
Yeah, it's cool.
Yeah, I'm fascinated by that. I may dabble in that. I'm not gonna lie. I'm just like, what is that? See, again, I'm just like, ooh, what can I do? Because it's so exciting and it's a way to get pampered and just, I don't know, just feel good, but like in a good way, I guess you could say.
Totally.
So I love that. Okay, so I guess we could talk about maintenance on things. I guess every patient is different, but when it comes to maintenance with IVs and supplements, what do you recommend for the I guess you could talk about anybody. Let's do typical people and then let's choose people with cancer.
Sure. So
I guess let's focus on IVs maybe. Let's do that.
So infusion wise, typically I tell people if they've never had one, like we typically have packages. I like people to do 4 like infusions to get their body up to the deficiency that they're usually at. So once a week for 4 weeks is a good starting point. Otherwise they can do every couple weeks if they need to, but doing that to get themselves rebuilt and then as needed, like it's like having a massage.
Yes.
People can have them once a month because they feel really good. They can have them once a quarter. They can do it when they have aches and pains in their shoulders and just need that extra, so really it depends on the individual. But I say like for the first time that you're doing it, if you can do once a week for 4 weeks, it really helps replenish your body.
That's awesome. That's good to know. And what's the difference between an IV and an injection?
Yeah, I get that question. The nurses get that question a lot.
Yes, it is kind of, like, okay.
So, and we usually have like IM injection specials of the month. So, so injection is like what goes into your skin, like the little syringe that they push in. They'll either do it in your deltoid, they'll do it in your glute, but that's just full of nutrients. Whereas the IV infusion actually has fluids and can hold a lot more nutrients. It can hold, I can put in 1,000 milligrams of something versus 20 milligrams, so it really affords a lot more. And the absorption's a lot different. Yeah. It's going through your blood in your system. So there's some people that like they will get their infusion and then we'll give them an IM injection of something as well because it's getting absorbed in different ways.
Oh, cool. I never even thought of that.
Yeah. Okay. I mean, if people, these are the people that like are asking for specific, like, oh, they have something going on. Like, okay, you need to get this and for stress support and then you need to get an immune boost. But there was something else that I was going to say about that. It'll come back to me.
Okay. Yeah, no, that's fascinating to me because you do offer so many. And the thing is nice too with the injections is if you don't have a lot of time, it's quick. It's nice, convenient.
And that's what I tell people. Or if your veins aren't cooperating or anything like that, then like an injection's an easy way to get them.
Yeah.
So yeah. Really.
And I don't know, the IVs, I mean, I'm sure so many people are like, I don't like needles. Well, hey, I don't like needles and I do it. So you just got to turn your head and then once it's in, you're good. And then you feel it's just worth it. I don't know. People's needle experience usually comes from like an ER situation or a hospital.
Yep.
And
at the hospital, they use really big needles. And with us, we are using baby needles. We're using 24 gauge, the smallest that you can use. It's really simple.
Oh yeah.
So
I'm that person.
Yes.
Yep.
I mean, everybody's that person. Yeah. Like, we tell our staff all the time, like we're literally, people are paying us to put a needle in them.
True.
So
good
how
point.
can we make this a really good experience?
Oh, I love that. I never thought of that.
Yeah.
Obviously, a completely different side of everything. Totally. Okay, so I have to ask, negative side effects on what you offer here. I know you probably get that asked a lot. But like when it comes to injections, supplements, IVs, hyperbaric, anything, is there any negative side effects that anybody should be concerned about when walking into your clinic?
Yeah, that's a good question. And, I think the people that ask that are the people that are just brand new to the integrative world. They're so used to hearing like, oh, these medications are safe, but watch out for your vitamin C. That might hurt you. And, I say that with sarcasm because it is frustrating, but it's good to know. And like anything that you put in your body, you need to be an advocate for, whether it's a medication or a supplement.
Agreed.
So again, knowing the sourcing of ingredients is really important. What was the question? Oh, the risk.
Yeah.
So typically, like I tell people, if it's your first infusion, if people are detoxing from, like, we use a lot of glutathione, which is the body's major antioxidant. Mm-hmm. So if it has a lot of things to clean up, they might feel fatigued for a day. Some people might feel flu-like if they're really working through something heavy with foot detoxing or with an infusion. But typically people feel energized. And if they feel that little downward slope, usually within 24 hours, they're like, whoa, I feel great. Mm-hmm. So there's that. Side effects, risks, just like anything, some people's bodies might not agree, but knock on wood, we've had people tolerate it really well. We don't typically have adverse effects from that. B vitamins are warming, so sometimes people can feel warm. If anybody feels of anything, we always turn it off. We let their body kind of get back, and we maybe turn it up at a slower rate or just do little tweaks, but people tolerate them well. A big question people ask is like, hey, I'm taking vitamins orally. Do I have to do this infusion, or can I do them on the same day? And my answer is yes. Mm-hmm. When you're taking some supplement through your, orally, it has to get broken down by your kidneys, liver, the detox pathways, and you're only absorbing a small percentage of that. When you're getting it through infusion, you're actually getting all of those nutrients into your body. So people can take their supplements on the same day if they're taking them, because typically they're different.
Yeah.
And a lot of times, like, B vitamins are water soluble. So if you're not absorbing them in that moment, like, you'll urinate them out, but you're not doing too much is the thing. Like, your body will know how to equalize that. So.
That's cool. That's really interesting to know. And I think one major thing is again, with vitamins, people just don't fully understand them because really mainstream media they don't touch base on that as much. So people are obviously always nervous, but I love that you can come here and you can ask questions. And also, as a person who might be new to the whole functional realm of things, you guys never make anybody feel like dumb or, feel bad, or you're an open book here. So you're so helpful, which is really nice too. I guess I can attest to that. And also, I do like this, I guess this doesn't go on like a negative side effect, but like I've came in when I was under the weather and I needed an immune boost, and oh my gosh, I can attest to that. Wow. It's just crazy what an IV will do for your body compared to supplements. Obviously, I still take the supplements, but it's completely different route. Like,
totally,
your body definitely lacks in places you don't realize.
Yes.
So,
you're speaking of illness, like when COVID happened, there was a lot of people that would literally call from the ER and they'd say, hey, they're just sending me home. I need something. And we have a private room for people that are acutely ill. But those people need support too, and a lot of times they need fluids and high quality nutrients. And honestly, in the hospital, when you're going to the ER, even if they do give you a banana bag, which is some B vitamins, usually it's low quality nutrients and it has a bunch of preservatives in it. So yeah, people would come here, and that's where a lot of our in 2020 a big growth happened, whereas people were like, whoa, I need to start taking care of myself. Mm-hmm. And I feel a lot better. So word of mouth has been really big for us as well.
No, I love that. Yeah. You've helped so many people. I don't even know. How would you even know where to start?
Thank you.
Like,
we just don't see that. Like, we just are like, this is what we do. And we believe in what we do.
Yes. Which is also like, that's incredible. In your staff, I don't even know how you picked your staff, but that's a whole nother conversation. But that is amazing. They're all so kind and knowledgeable. That's another thing. Like, I have asked them so many questions about, well, why this or that? And they're like, oh yeah, this. I'm like, wow. Like, that's really refreshing too. And they'll sit there and they'll explain something to me, and they won't make me feel any less or not knowledgeable because of it. Like, they will fully explain things, which is helpful.
They love learning, and they love teaching, and that's cool. And we are all learning every single day. And luckily we connect with each other in various ways all day long, so that there's, if someone doesn't know a question, it's like, just tell them that you don't know, but you'll find the answer. And so, because there's all these resources that we have, so we don't want someone to just guess they don't need to. Like, we can actually give educated answers to people. So
yes. And I guess on top of that, piggybacking off of that, what's nice is when you come here, somebody's actually going to take time to talk to you and explain things to you. Like, again, there is reasons. There's time and a place for Western medicine. Don't get me wrong. I'm a big advocate of that. However, it is kind of refreshing to come here and having somebody fully give you the whole spectrum of your options, not just this is it and that's it.
yes.
So
Empower, like my word of all of my businesses, all of my, I think, life mission is empowering other people to just know both sides, to all sides, and then get to choose what's best for them. And they live in their body, they go home with their body, they die with their body. They get to choose what they ultimately want to do, but they should know all the things and not just one side.
I love that. I was actually going to ask you about that, how you go about empowering patients, about knowing what's good choice for them, and obviously education.
Yeah, and honest and doing what we do so well in integrative functional medicine is we get in-depth labs. We don't just do 3 labs and say, oh, you're fine. Like, we actually listen to the patients. We see that they're not okay because they're telling us something's wrong, and we're spending an hour with them versus
Yes.
5 minutes. So, like, it's not a doctor's fault in Western medicine. Like,
No.
they are in a system that is broken, and so they have to come in and quickly, like, oh, you have an ear infection, let's give you this. Like, versus saying, okay, like, but why is this happening? So we spend time to figure out, like, what's happening in your body, and let's get a full gamut of labs. And then we get to see what's going on, and then that's how we'll make our suggestions.
I love that. That's awesome. On top of that, what is your ideal client? If you would have to say, oh, that's really tricky for you because you like to focus on all range of people.
So it's interesting. So oncology has been, I never wanted to put my toes into the oncology world. And when I opened up my practice in 2016, I had someone call me and say, hey, University of Iowa is doing this study on high dose vitamin C. I want to get it for cancer. And I'm like, oh, no way. I'm not doing that. Mm-hmm. And then it kept coming. And I was like, shoot, like, I can't stop this. And cancer's unfortunately very prevalent. And, and they say something about like one of every 2 people will have cancer in the future. And I was like, I have to learn. So like, I went full deep into cancer, doing a whole bunch of conferences, masterminds. I'm currently in a really big metabolic group that we work through, and we go through, we have people all across the country that are in this mastermind that develop plans for people. So that was kind of where I switched my emphasis of working with the hardest people that you can, right?
Yeah.
But honestly, like, I also, this past year, I launched Harmony Within, 12-week women's hormone rebalancing, because that stuff is easier to me. I'm like, oh, give me their labs. I can do this. And I know that they're going to feel good right away.
Yep.
So that stuff's really, enjoyable too.
Yeah. I love how you're always just trying something different, but obviously focusing on what's needed, but then always something different. That's cool.
I just listen to people, like, what they need. And my girlfriend that I helped her balance her hormones postpartum, she's like, everybody needs this stuff. I'm like, are you sure? Because I don't see when you're in it, you just don't know. And she's like, I think you should do it. And then I just kind of put up a couple posts about this. And within 2 weeks, I had my 15, well, I was only going to take 10, but I had 15 people sign up right away. And I'm like, oh, women need this. Women want to feel good.
Yes.
I mean, so do guys, but this is like, it's focused. So yeah, women want to feel good. Their hormones are imbalanced. They've been told that they're either crazy, they have, like, put them on an antidepressant. It's like, no. You just had babies, or your hormones haven't adjusted from even teenage years. Like, and you've been on birth control and never had the opportunity to, like, really regulate things. So anyways, I'm doing that it's online. I got their labs. I give them a personalized plan, and then we're going through this together. So it's been really good.
That's so cool. Okay, I'm doing the next one.
Okay,
I'm already.
You're in.
Sign me up.
You're in.
I'm doing it because yes, I have suffered from that, and it's just defeating when, like you said, this. Not that nobody listens, but they don't. They're just like, oh, you're fine. You're fine. Your blood work that they did, which was obviously very small, like, you're fine. Okay, but I don't feel fine. Yeah. So I love that you're just willing to dive further into things, because that's refreshing too.
there's been so many women that are like, wow, like why?
Awesome.
They get angry, right? Like angry of like,
Yeah.
why this is so easy. It seems so easy. Why wouldn't they do this? And again, like it's not in the toolbox of conventional medicine, and doctors don't have time to go home at night and like learn all these. They could, but they just don't have time to learn all these new things. So yeah. Anyways,
you need like 2 of you sometimes.
At least one more hand.
Yes,
or something.
exactly. Okay, I really want to know a random success story. It could be lately, it could be 5 years ago. Something that really you're just like, wow, that was impactful, maybe to yourself or your practice. A really good.
That's good.
Great.
Yeah, there's like, I'm so blessed, and that's why I do what I do, is because I can actually see results from people. So this is more of a challenging question. One that's like popping up with oncology is that I had a gal that had cancer by her liver gallbladder, and she did high dose vitamin C for a series. Sometimes they do it 1 to 2 times a week while they're going through therapies, but she wasn't, because she wasn't even operable at that time because it was the position of the tumor. So anyway, she was just doing high dose vitamin C. And then she got to a point where she was ready for surgery, and the surgeon made a comment to a doc that ended up telling me that he never has went in and like literally like grabbed the tumor off of the organ system. Like he didn't have to cut it away. It wasn't sticking. Like he said, it was like the smoothest removal of a tumor that he's ever seen.
Wow, that's incredible.
Yeah. And I mean, I get that all the time. There's a patient that like went in, she had a huge tumor, and then it shrunk so much, and like they couldn't, like then she was operable. And so there's all these little wins, and not everybody comes out of here alive. And at first, when I was a new nurse practitioner, it was like, oh, I have to heal and save all these people.
Yeah.
And then one of my mentors was like, who do you think you are? Like, do you think you're God?
Yeah.
Because you have no idea why they're walking through your door.
Yeah.
It could be for an extra month with their family. It could be for an
Yeah.
extra 3 months. It could just be to how, like you don't know as a person, like what your impact is on other people. But yeah, ultimately you're not God, and you're just here for their journey, and I'm just trying to do the best that I can for each patient that walks through the door.
That's incredible. I love it. And yeah, oncology is something completely different, especially to me. However, when I was here the other day getting my IV, a man sat next to me and he told me his whole story. His 5 years. He has had pancreatic cancer for 5 years, and he said his oncology team is blown away how much his tumor shrank just from high dose vitamin C. And he's just like, I just laugh. I just like chuckle every time. And I'm like, he's like, you should have seen me 2 years ago. I was 60 pounds lighter. I didn't feel good. But he's like, this is worth it. Like, he is a pure advocate to your clinic. It just, and of course me, I'm like hormonal. I'm like, oh my gosh. Like, like just tears rolling. I'm like, I'm sorry, I'm crying. He's like, it's fine.
Oh my God.
Yeah, but just that has to make you feel good too. I mean, obviously they don't all turn out that way, but that's pretty cool.
Yeah.
I love that. And me, and just another patient, like, oh my gosh, like this just makes you want to like scream it at the top of a rooftop, like, hey, it's here to help. I mean, and it's worth it. I mean, and that's another thing. I'm sure people are like, well, my insurance doesn't cover it, but there's things you can spend, or, you can not spend and then do something else in replace of it. So.
Yeah. What is your health worth? And
Perfect way to put it.
Yeah, it is. And that's obviously when someone doesn't have health. I've been in that position of being very sick. Like, you'd give anything. You'd give anything to have your health. And and that's where they are. Like, they understand the benefits of this, and they're willing to make that investment. And like you said, if you're not spending it here, you're doing it on something else. So it's all the balance. And
absolutely.
Yeah, totally.
Going back, you had said that you have a new nurse practitioner.
Yes.
Can you tell us a little bit about her?
Yeah.
Or what she does, I guess?
Yeah. So Maggie Gothard, she's been around for many years as a nurse practitioner in different fields.
Okay.
She actually, what I loved about her was she was working acute care, which obviously, if you ever want to go to integrative medicine, it kind of gets soul sucking really quickly. But people were coming in with their kiddos, and she was recommending them like garlic mullein oil, or having people come and get supplements. And I was like, Yes, like she gets it, and she really got into like trying to figure out alternatives for ADHD and different childhood pediatric illnesses. So we started talking, and I'm like, you'd be really a great advocate, and I can't take on any more patients right now. And so she has been with us since we opened this clinic in Peosta, and she takes pediatrics, adult women's health, men's. It's just functional medicine in general.
That's amazing.
Every one of her cases we run by each other. So she'll come to me and she'll be like, hey, this is what I have. This is what I'm thinking the plan would be. And then I either say, oh, maybe this is something I would think about too. So everybody gets four eyes, and it's just a really good, then I don't have to, then I can be doing other things as well. And then we can still talk about the patient. So.
Oh, neat. Okay. I did not realize you took a look at it too. That's cool. And as obviously, if I were to take my child or even myself, I would appreciate knowing that there was several different opinions on that. That's cool. So how would I go about making an appointment to do that?
So people typically go to, or they call our clinic, or they can go to the website. I still have it. We're meshing in all of our businesses into one website. So that's currently getting designed, but balancehealth.me has like the services, has a little bit of background about Maggie and myself as well. But that's where people can go and get more information, pricing, structure. We are a cash-based clinic. So we do functional medicine visits, women's wellness, men's wellness, and then acute care visits. So that is something that's cool and new as well. So that if someone has an acute issue, I'm blanking on the cost right now, but it's maybe $100 or something for them just to come in. And then if people have Blue Cross Blue Shield, United Healthcare, they can actually take those, and Maggie does super bills for everybody. And so then they can turn them into insurance for possible reimbursement.
Awesome.
So if they've met their deductibles, like their insurance will pay for them. So
that's amazing.
It's really great. And she's a board certified family medicine practitioner. So she's under all of the qualifications. When they need blood work and they get it here, we also, again, submit that to insurance so that the patient doesn't have to deal with that at all.
Wow.
So
that's like a breath of fresh air. Yeah.
Again, because it's confusing.
Yep, it is.
Like cash pay is confusing. The thing is that they have to pay for it up front versus like having insurance take it and maybe deny it, So but that's just, it's easy for us that way, because then we can actually help people. We can actually sit our allotted, more than the allotted time. We take our appointments, and really that's what's been helpful to people and helping them heal.
That's amazing. You truly care about your patients, and that's
100%.
That is amazing. And I'm sure like obviously a lot of doctors go into it thinking that's like their goal, but then they just get swept up in everything. So
yeah,
that's nice. You guys are definitely very set apart from the rest, especially I guess in our area, there's not anywhere else like this. So that's amazing. What advice would you give somebody considering wanting to get into functional medicine, or even coming here for the first time? I guess if it's anybody, like where would they start? I guess, would you start them with an injection? Would you start them with supplements? Would you?
Yeah, that's really hard to say. It just depends where the person's at and their curiosity.
Yep. Okay.
And what their interest is. Some people, they're like, oh, I want to do that foot detox thing.
Yeah, that's a good one. Okay.
Yeah.
Yep.
And I mean, that's simple, easy for people. If someone is really, I love giving them injections, like doing a B12 and a D3 injection. Those are like my two favorite together, like this energy boost, stress support shot, weight support shot. We have all of these shots that someone can get, and they can feel the effects of right away. And then maybe they'll be like, okay, now I'm going to try that infusion and get the, so like, it's just the tiptoeing of that. And yeah. And like you said, like they could come in and maybe just start with a high quality multivitamin.
Yep.
And so we just try to meet people where they're at and suggest based on them.
I love that. Okay. What is the most rewarding part of what you do here at Vive, or for Select Balance, or just, being in the functional medicine field?
Yeah. Gosh, there's so much.
I know that's kind of a loaded question.
But honestly, like just being able to help people, and knowing that they can come off the chair, they can come in having a really bad day, and they leave here feeling good. Like getting to actually see people heal. Have women tell me that have been on a fertility journey for many years say, I was on your protocol for 1 month and I'm pregnant. Like those things,
Wow, that's
you
amazing.
can't ever quantify the magnificence of it. Like it fills all of our cups. That's why I think the staff is so amazing, because they are like, whoa, I am helping create all of this, So it's just people actually feeling well and knowing that we're trying our best to give people all the options.
I love that. So you kind of talked about the future of Vive, like what else you're going to add here. So what about Select Balance? What do you have in the works for that?
Yes. We're continuing to develop new products, improve any products that we do have. This was 2016 when we started. So we are always constantly like, is there something else that we need to be adding or changing to this protocol? Because, some of our supplements, like our prenatal, for example, we've redeveloped that twice. Like, okay, well, maybe we can put a little more of this in or less of this based on feedback from our patients.
Yeah.
But we always are working with new partners. We're working right now with doing some private labeling for a huge oncology line. So if that would work, that's gonna be magnificent. So we're just always keeping our
Yeah, you're definitely always doing something.
Yeah.
I love it. You're just basically, like you said earlier, like what your patients need, that's what you're going to bring to the table, which is really nice.
Yes.
What do you see like a future in functional medicine? I don't know about like around this area. I don't know, just in our world in general. Where do you see functional medicine going?
I'm hoping that medicine in general goes towards functional medicine. I'm hoping that it's going to be hard. It's going to look really drastic, I think, when it changes. Like, Western medicine basically has to crumble in order to be like, okay, this system doesn't work anymore. How are we going to be able to if we have insurance, like how can we have that pay for integrative functional, like how can we keep people healthy?
Yeah.
Not like, okay, now they're sick with cancer. How can we spend millions of dollars in an autoimmune disease on their lifelong drugs? Like, how can we get out of that? Mm-hmm. But I see it coming like this, like having clinics where you can actually go and get to the root cause and spend time with your patients, have alternative modalities for people to offer and make people feel good.
Yeah, and just be preventative.
Yes.
I think that's the biggest thing. Like, I wish that a lot of people knew is just be preventative. I mean, obviously, everybody gets a cold, everybody gets sick, but don't let it get too far. Mm-hmm. And it is a lifestyle change. It's obviously what you eat, but there's just different ways that you can you only get one body. Why not just give it what it needs?
Totally. So. Yes, that's so good. Yes, just really, really realizing that it's just learning. It's just taking one step, like cleaning one room of your house, like going to your laundry room and taking out the Tide and like getting natural, non-toxic options. Like people think that going to this side is really expensive, and it doesn't have to be. Mm-hmm. Like organic, I'm just jumping all over the place, but even like organic meat, like getting a fourth of a cow or like sharing that kind of, you can do things to offset costs. Yes. And I think we're more and more getting to that, but it's just, again, the slow changes. It doesn't all have to happen at once. It doesn't have to be overwhelming.
Yep.
And I think people having like friends like you that can just give them subtle suggestions and they trust you.
Yeah.
Makes a big difference.
Well, and I always think too, like, it's what are you going to spend your money on? Like what's worth to you? Like me, like obviously health is a big thing. Like now, like for instance, we don't buy like bread. Well, we might randomly, but usually don't buy bread. Like I make that like sourdough. Like that's what you do. You can make, but that's so much more cost effective. Like you said, like cutting down, there is ways to do it, but it is intimidating because that's all that people know is like, oh, you go integrative way. It's very expensive. We don't do that. But no, there's so many people out there that are going to help you along your journey. I think that's good to know too.
Totally.
I do have to ask, because it is the health spa and you mentioned massage. Are you ever going to offer a massage therapist here?
Yes.
I have to ask.
We are totally,
yes.
Actually, we are currently in the search for one. I really want to have a lymph specialist here. So lymph is a whole nother story, but it's a different type of massage that can really help like open the detox pathways. But I also want there to be a massage therapist here as well that can really just have people R&R, rest, relax, and just enjoy their time. So yes, it is in the works. It is coming.
Really? That's
Yes.
awesome. I love it. And I love, so obviously we know each other outside of like me being a patient. We obviously are in this whole small business era with a ton of amazing women. And I do love that you work with them, they work with you. It's just a whole conglomerate of amazing people that like obviously I'm sure like for PT reasons, like, a PT or, social media, like it's just great. I can truly attest to that with you and in this realm of things too. It's just neat to be so supported around here.
Yes.
And I hope everybody feels that way too.
Oh,
because I see it firsthand, obviously.
Totally.
Like, well, okay, we're going to go on a random tangent now. Like PT, okay. You suggested going, to prenatal, postnatal, and now I'm like, oh my gosh, a world of a difference. But again, like she's more functional, and then did the craniosacral with one of my babies. It was just once you just I don't want to say let your guard down, but once you're open-minded enough to try something new and get out of your norm.
Yes.
And you might fail, obviously, in things, but it is so worth it.
And like you're saying, like, and someone might not be the perfect fit for you.
No.
And that's what I tell people, like, we might not be the perfect fit, and that's okay, because there's a lot of other people out there.
Yep.
And if you can get connected in the world of like integrative health, there's so many practitioners in this area that we're so blessed with.
Yes.
That you can find your route to health through that. So
yeah. Oh, I love that.
yeah. Okay. Well, oh my gosh, Lindsay, thank you so much for coming today.
Yes.
Like, I wanted to do this for so long, and you were the perfect person. So thank you so much.
I feel honored. Thank you so much for inviting me. This was fun.
Yes.
It's totally out of my realm. I love it.
Cool.
But I love learning, so this is great.
Let's do it again someday.
Yeah, let's do it.